Welcome to today's webinar presented by Supercoder.com. Supercoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
Friends and colleagues and loyal subscribers to Urology Coding Alert. I'm Dr. Ferragamo, and I will be your presenter for this audio conference. I do hope that you all have your handouts because we will be following that as we proceed through this presentation. Page 1 of the handout is the title of this presentation, 2012 Urogynecology Coding Update. Let's go to page 2. Page 2, it tells us that we have a few ICD-9 changes and some diagnostic coding additions that I'd like to bring to your attention. Let's go to page 3. We have a new 2012 ICD-9 diagnosis, and this is concerning problems with an implanted vaginal mesh. In fact, these two ICD-9 codes became effective on October 1st, 2011. The one code, ICD-9, is 629.31, and this is an erosion of an implanted vaginal mesh or other prostatic materials into a surrounding organ or into the pelvic musculature. That this would be erosion of a mesh into the urethra, into the bladder, possibly into bowel, and it's the erosion also of the vaginal mesh into the pelvic floor muscles. Let's go to page 4. Now the second code, new code, again concerning problems with implanted vaginal mesh and also becoming effective on October 1st, 2011, is the ICD-9 code 629.32, and this is exposure of implanted vaginal mesh or other prostatic materials into the vaginal wall or exposure of the vaginal mesh through the vaginal wall into the vaginal canal. We are also told by the ICD-9 manual for 2012 that we should report these two new ICD-9 codes, 629.31 and 629.32. We should report these for their particular problems of the mesh instead of a code 996.76, complications due to a genitourinary device and graft, and also in place of the code 996.65, infection and inflammation of a graft. In fact, the manual tells us that ICD-9 code 996.76 excludes complications of an implanted vaginal mesh. Let's go to page 5. So now, when we have a revision or removal of a vaginal sling or mesh, we should be using, if appropriate, the code 629.31 and 629.32 in many of the CPT procedures, such as 57287, which is a vaginal revision or removal of a sling, 27087 and 27086. This would be abdominal or retropubic revision or removal of the sling. And also we have codes 57295, which is a revision and removal of vaginal grafts via an abdominal approach, 57296 via an open abdominal approach, and use these two codes 629.31 and 629.32 if appropriate for 57426, which would be a revision and removal of a vaginal graft via a laparoscopic approach. Let's go to page 6, and I'd like to talk to you a little while about colpopexys, or suspensions of the vaginal apex. In the vaginal approach, we have two procedure codes. We have 57282, which is a colpopexy vaginal procedure. It's an extraperitoneal approach utilizing the sacrospinous ligaments. It also
SuperCoder is the fastest growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo or sign up at supercoder.com for a 7-day free trial.